What if the meniscus tear your surgeon wants to just monitor could actually heal itself? No surgery, no downtime, just using sound and magnetic waves. Hi, I'm Dr. Jason Hahn, physical therapist and regenerative therapy expert at HealthFit Physical Therapy and Chiropractic here in Pasadena, California. Today, we're talking about a breakthrough approach to treating meniscus tears without surgery. We are going to explore why some meniscus tears never seem to fully heal, how we are helping patients repair them using advanced regenerative therapies, what kind of results we're seeing in real patients and real research, and how to know if you're a good candidate. Every year, thousands of active people, runners, athletes, and even weekend warriors find themselves sidelined by meniscus tears. They're often told to rest, maybe do a little rehab, or wait and see if the pain goes away. But here's the truth. Many of those tears don't heal on their own, and surgery, that's not always a better option, especially for smaller or degenerative tears that aren't severe enough to fix with a scope. The exciting news is that the body can heal certain meniscus tears when given the right stimulus. That's where this trio comes in: radial shockwave therapy, focused shockwave therapy, and EMTT, also known as electromagnetic transduction therapy. These aren't science fiction. They're non-invasive tools we're using right now to help the body repair itself from the inside out. Let's break it down. Here's what each therapy does and what it actually feels like for you, the patient. Radial shockwave works closer to the surface, about 1 to 3 centimeters deep. It's especially helpful for the tissues around the joint like the capsule and the muscles. This one feels more like rhythmic vibrations or gentle thumping. It's very tolerable, and some patients even say it brings immediate relief. Focused shockwave reaches deep into the knee, right where the meniscus sits. It triggers a healing response by sending acoustic waves into the joint. Most patients describe it as a firm tapping or a pulsing feeling. Not painful, but definitely noticeable. Afterwards, you might feel a little soreness, like after a deep tissue massage. EMTT is totally hands-free. You'll be sitting or lying down as a magnetic applicator is placed near your knee. You might feel a subtle pulsing or warmth, but many people feel almost nothing during the session. Behind the scenes, though, it's supercharging your cells, boosting metabolism, calming inflammation, and accelerating tissue repair. Each treatment takes about 15 minutes, and there's no downtime. You walk in, you get treated, and then you walk right out, often feeling looser and more mobile right away. Let me tell you about Luis, a dad and former athlete who came in with a small degenerative tear in his meniscus. He had already spent 6 months doing watchful waiting, still stiff, still sore. We started him on a personalized plan using focused shockwave and EMTT with some simple rehab exercises. Within 4 weeks, his pain had dropped dramatically. At 6 weeks, he sent me a video, him crossing up his teenage son on the basketball court, laughing, pain-free. That's the difference this real healing can make. So what's the approach we use here at HealthFit? We typically follow a 6-week protocol that looks something like this. We start with radial and focused shockwave once a week for the 6 weeks to directly target the damaged area. We use EMTT twice a week for the first 4 weeks to enhance cell recovery. And all of this is paired with strategic loading and controlled exercises, because proper movement is just as important as any device. And here's what you can expect. Most people feel less pain within 2 to 4 weeks. By week 6, we expect a minimum of 50 to 70% improvement, but the ultimate healing and return to more advanced activities takes approximately 10 to 12 weeks, depending on the tear. So it's not just symptom relief, it's true tissue healing. So why aren't more people using this approach? Honestly, because the medical world changes slowly, even when the evidence is solid. Surgeons do amazing work, but many aren't yet trained or equipped for regenerative options like this. But active people, they're not waiting around anymore. They're looking for safer, smarter, more effective ways to heal without sacrificing their lifestyle. Imagine a future where the surgery for small meniscus tears is a last resort, not the first. That future is already here for many of our patients. These regenerative therapies are changing how we treat joint injuries, not by replacing the body, but by helping it do what it was always capable of doing: healing itself. If you've been told to just wait or live with your knee pain, it is time to explore a new path. Book your regenerative knee consult here at HealthFit in Pasadena. Download our free regenerative therapy guide for more education, or share this video with someone you care about because they deserve better options too. I appreciate you taking the time to watch this video. Let's help your body heal and get you back to doing what you love. Hey, if you found this video useful, please give it a thumbs up. Don't forget to subscribe and hit the bell notification for our latest tips coming to you every week. Share this video with your family and friends. It might just make their day a little bit better. I'll see you soon.